Thank you, Dr. Sheetal, and happy Navratri to all. Of course. So now let's um, look at heart care and kill all the demons of heart diseases which will be attacking us or which could attack us if we aren't aware of it. Okay. So once again, thank you for such a wonderful platform, Dr. Sheetal, for giving us this opportunity. So let's start with it. So today's topic is heart care and women. Okay. So what do we know about heart care? Whenever we listen about heart, of course, um, everybody is very panicked about, oh yes, I heard about some heart disease or heart attack a woman got last yesterday or something. Okay, so just let's look into heart diseases. So what do researchers have to say? Heart disease is the nation's leading killer of women. So in women, the major reason of death is due to heart attacks. Women in middle life are definitely at a higher risk. It's a volatile time for women as menopause transition is marked by changes in the body composition, fat distribution, and an increase in the cholesterol levels. So, in women, the mid age women are at a higher risk. Recent research has focused on heart disease linked to pregnancy related complications. Like in nowadays, we see there are many women who have diabetes during the pregnancy, hypertension during pregnancy. They are tend to deliver. They are tend to have cardiovascular diseases or these diseases like hypertension and diabetes at a later age. So that is a precursor, we could say, to the heart diseases. Pregnancy is a stress test for the body, a possible marker of heart diseases in later life. So, says Mir. So, whatever diseases we have in pregnancy, we could take it as a precursor and be cautious about it. Let's look at the WHO verdict, WHO verdict, that is, the World Health Organization has said that India is set to be heart disease capital of the world in 2020. So, and that is pretty much true. Next is just let's look at the mortality percentage in India due to these disorders. That is, heart disease are at the highest, that is 24.8. Respiratory diseases come lower to it. Lower to it is TB and last is cancer. So the heart diseases are the are at the top. Again, comparing it to the Western countries, India is far more ahead with 52 percentage. Okay, so now let's see the causes of heart disease. When we say heart disease, any heart disease could be due to any of these five things. Okay, like high blood pressure later on tends to result into heart disease if not taken care of properly. Likewise, diabetes, obesity, raised cholesterol, and endothelial dysfunction. Each of these later on grow up into a heart disease. Then, what are the symptoms? Why do we have to take care of BP and diabetes? Because they directly affect the nervous system. Kidneys are the most affected. Again, heart and the blood vessels are at risk. Eyes are at a higher risk. And again, foot problems do merge. Looking at the first thing, that is BP, among what we said. Okay. To know your health, we need to check our health parameters, which are the first one is the pulse rate. Normal pulse rate would be in the range of 60 to 100. 72 uh, is the most appropriate. Blood pressure, normal range, everybody knows that is 120 to 280. High blood pressure, we consider it above 140 by 90. Again, hypertension is the most neglected uh, disease. That is, half of the population does not even know that they have hypertension because they have not even checked it. Unless and until they get any other symptoms like, say, headache or um, palpitations, they don't even know, although they don't even go to check. So, high blood pressure is very neglected, and later on when it damages something, then we come to know that yes, it was because of high blood pressure. So the main thing over here could be that we need to check all our parameters at a regular intervals. Lack of sleep, getting less than 6 or 7 hours of sleep at night is connected to heart disease. This is research, recent researchers have said. So poor sleep has been linked to high blood pressure, can make it difficult to lose weight, and make you less likely to want to exercise. Now, this is usually seen in working women that they have a lot of stress, and because of long working hours, they come home late, and then they have many things to do, and later up tend to compromise on their sleep. So but this eventually, if nothing is done, will lead to hypertension. This is the researchers have said, and again, this will um, again make it difficult to lose weight, or rather put on it tends to put on more weight, and makes us lethargy, which will again decrease the want to exercise. Chronic stress is another concern for women. It can lead to behavior and factors that impart heart disease, such as high blood pressure, high cholesterol, inactivity, and overeating. Okay, stress. I don't think so. There's anybody who doesn't have stress at all. Okay, so this is a factor which everybody, each and every person of us, uh, come uh, can be considered over here. So maybe mental, maybe work stress, maybe family stress, anything. So stress also tends to increase our blood pressure. Okay. Next, as we saw for the reasons of heart diseases, the second was blood sugar. Of course, in diabetes, the fasting, the normal range of fasting, everybody must be aware of this. That is, the range of fasting blood sugar is 70 to 110, and postprandial, that is BP, should be about 140. For HbA1c, here we consider HbA1c as more reliable because in fasting and PP, those who are diabetic are very prone to influence the test. Like they know that tomorrow we have to do the test, so today it will be less of eating. So this is cheating on the test itself. So instead of relying on fasting and PP, we rely more on HbA1c, that is a 3 month average, which we call it as. It is the okay, normal range of HbA1c is from 4 to 5.6%, and those who are pre-diabetic come from 5.7 to 6.4, and of course more than 6.4 will be diabetes. Next, which we saw in the reasons of heart diseases was obesity. Now in obesity, oh, when do we call as obese? For that, we have a marker which says body mass index, that is the BMI. For a healthy person, the BMI range is from 18.5 to 24.9. So below 18.5, we would call it as underweight, and above 25, we would call it as overweight. Again, overweight could be again in two classes, that is 25 to 29.9. We could call it as overweight, and above 30, it would be obesity. So, how is this BMI calculated? BMI, the formula is given, that is weight in kgs upon height in meters square. So, this is the standard which are known to us. So everyone should be aware whether what is our BMI and are we in the healthy range or no. Mm, Even while treating hypertension and diabetes, we consider BMI as an important factor. When we lose weight, that is when the excess of weight is lost, then only we can guarantee the reversal of any disease. Um, so losing weight and of course having a check on the abdominal girth helps us um, to reverse the disease. Of course, over here I would like to say that reversing BP diabetes is possible, and many have done this in Mother. Next is cholesterol. Okay, so dyslipidemia, it is also known as, that is raised cholesterol. Everybody is very concerned about it nowadays. So for that, we need to check our lipid profile regularly. So the normal range, we should know it. That is HDL, that is high density lipoprotein, is 40 to 60. LDL is 100 to 120, and cholesterol is the addition of both, that is HDL plus LDL, which is 20% of the triglycerides, uh, which we know. So again, when when there is a rise in the cholesterol, the excess of fat tends to um, stick to the arteries, which is again going to lead to atherosclerotic arteries. That is, the elasticity of the arteries would be less. So again, when we look at this, that reminds us of um, blockages, right? So blockages would be taken a bit later. Endothelial dysfunction is a fifth most important cause of heart disease. This is a new term. I mean, the other terms, at least everybody is aware of. So, looking to this, uh, what do you say as what do you think could be endothelial dysfunction? It is a type of non-obstructive cardio CAD, that is CAD, wherein this is no blockage but large vessels constrict. This is mostly found in women, and the main reason over here is the nitric oxide is reduced. Okay, to find this, the test to be done over here is angio defender, and the score, if the FMD score is more than 10, it is at a lower risk. If the score is 6 to 10, it is a moderate risk. And likewise, if it is uh, below 6, it is at a more risk. What is endothelial dysfunction? That is, endothelium, when we are talking about, it is the innermost layer of the arteries, right? When that is damaged, it could lead to endothelial dysfunction. And what are the reasons it could? In high blood pressure, this is mainly seen. Again, talking about nitric oxide, the main role of nitric oxide is when we are into some great activity like running or playing or uh, eh, into some activity, the blood vessels are supposed to dilate and there is more blood rushing through it, right? So and when we are relaxed, it is supposed to contract. This activity is taken care by the nitric oxide, but when that is reduced due to accumulation of plaque or due to arterial thickening, that is going to, and there is any crack in the endothelium, that is known as endothelial dysfunction. Now, how will this affect us? Will come in in the next slide. Okay. Looking into the investigations, of course, ECG, that is electrocardiogram, is the first test, simplest test, which can lead us to check the electrical activity of the heart. Uh, so this is the most primary test which is done. Next thing we go for is the stress test. Now, talking about the stress test, it is a test wherein we are artificially inducing stretch. So, so it is called as stress test. The normal stress test is of 15 minutes, wherein after every 3 minutes there is a increased speed or increased height of the machine, and if there is no complaint, of course, and a continuous ECG is monitored during the stress test. If there is, if the person walks up to 15 minutes without any problem, then the stress test is said to be negative. And if it is stopped in between because of any reasons, could be the pulse has increased, the BP has increased, there is uncomfortable behavior, or there is breathlessness, then that could lead us to some or the other uh, reasons. Okay. In heart attack, what is an heart attack? Heart attack can come anytime and to anybody. It is not yet found why did a heart attack occur in any person. So what can be done if we don't know the main cause, why is it happening? Many a times people say that it appears to people who smoke, but no, there are many incidents where people have not even smoked, and they have got heart attack. Or there are many people who are chain smokers, but they haven't had heart attack till now. So the reason for heart attack is not known, but the uh, when looking at the post-mortem of an heart attack person, we have come to the conclusion, or the researchers have uh, uh, reached to a conclusion that heart attack is majorly due to a blood clot. Okay, so whenever there is, and what could be the main reasons of clot formation? So that is because of the inflammation. If there is any inflammation in the arteries, so that could cause blood clot. And if the arteries lose their elasticity, as we said earlier, due to due to nitric oxide decrease, so that could lead to an heart attack. So we do not know the main reason of heart attack, but it is because of a blood clot. Later on, with further studies, we reached to a conclusion that there are three types of people. Okay. In one, in the first type, he got the first attack, and he died on the spot. Second type of person, he had a severe chest pain. He was hospitalized, and then he survived. And in third person, he got an attack. He had no some symptoms. He was comfortable, but doctor identified it 6 months later on an ECG. So what is the difference between these three? Okay. Here comes the concept of VO2 max. That is, VO2 max is the aerobial capacity of the heart, which helps us to know what could be the reason what could be the reason to distinguish between these three. The VO2 max of the first person considered over here was very low, and that is why this person expired. That is, he could not even sustain the heart attack. Next, his VO2 max was a bit more than the first one. That's why he had a severe heart chest pain, and he could survive. And whereas in the third person, his VO2 max was very good, and that's why he didn't even have any symptoms, and he was fully comfortable, and he didn't even know. But the doctor told him that he had an attack many months earlier. So VO2 max. Now we'll look into what is VO2 max. Now it is the functional capacity of the heart. In normal stress test, we saw about the stress test. So when the stress test is normal, the normal value of VO2 max seen over there is 35 ml per kg per minute. Okay, so VO2 max is calculated when we run a stress test. Okay. As a result of good VO2 max is the coronary reserve. That is, whenever mm, the coronary arteries dilate and contract, they have their own reserve. This coronary reserves helps us to get the collaterals active, and that is the result of a good VO2 max. Stress test will hence a stress test will help us to know the VO2 max of our body. If there is low VO2 max, then or rather the stress test is not completed. What could be the reasons for stopping the stress test is there could be shortness of breath, there could be chest discomfort, uneasiness after sudden exercise like climbing the stairs or running to catch a bus or train, swelling over the legs, palpitations, and sometimes this could be even be silent. So to improve the VO2 max, in order to improve the VO2 max, mm, these things are a healthy lifestyle is necessary. That is, there should be exercise every day. The stress management should be done by yoga, say meditation, and proper diet will help us to increase our VO2 max as well. That is the functional capacity of the heart. Again, when we talk about the diet, salt restriction per day, it is 2 to 5 grams per day of salt should be used. Use of oil, we say that is just half a liter of oil per person per month. That is 10 to 15 ml per day per person. And go green, that is green vegetables and fruits are always healthy. For exercise, what we say, exercise, if you do not have any other um, mechanism of exercise, or you don't want to spend much on it, walking is the best exercise. It is known as king of exercises. There is no need of any training or anything. Weight control is a major thing which helps by uh, which is gained by walking. It strengthens your heart because there's some exertion, and you are making the heart um, by walking. You are stressing on the heart, and you are exerting your heart, and you're giving it a practice of so walking is best. It helps us to control the BP, control cholesterol, increases metabolism. It boosts your vitamin D levels, beneficial in arthritis. This is achieved when there is early morning walk is done. It makes you happy. That is, it reduces the stress. So any form of exercise will be good, but the simplest and uh, most effective is walking, of course. Of course, in other exercises, there could be Surya Namaskar and other yogas. If done wrongly, it could again harm the person, or there could be some uh, other issues. So instead of that, we mostly tell people to have a simple walk. This walk should be around 45 minutes. So, and done early morning without having anything is the best thing that anybody can do. And of course, it helps us to increase our antibodies also, activates our antibodies against anything. So that would be the best thing. Stress, awareness of stress, control measures, do meditation, use of different relaxation techniques to overcome the stress, reorientation of thinking process. Now, there are many ways of relaxation and meditation which we come across that is very essential for everybody now because the stress levels are increasing. And in your healthy schedule or work time, if you do not take out time for stress and exercise, um, uh, later on in the disease thing, you have to do it or else you are bedridden. So now is the time when we actually mm, can take care of and not land into something problematic. Take home message: heart checkup, that is stress test will tell you how healthy your heart is, your VO2 max, and your chances of survival if you get an heart attack. So stress test is important. Check up on every birthday. Care for your heart because it cares for you every second. Heart is the only organ which is working for you right from when you were in the womb. So without any stop or without any holiday. So you need to do something for your heart to keep it healthy and of course for you to be healthy. So what do we learn from this stress test is to see the condition of our heart, and angio-dependent test is a test to see the endothelial, if there is any endothelial dysfunction or any damage. What we need to think here is, what does a healthy heart indicate? I enjoy my sleep without getting up, getting breathless at night. This is a sign of healthy heart. I never suffered any chest discomfort after having meals. This is also a very good sign. We need to check upon these signs, uh, or even if you have it once in a while, you need to be alert. Rather, you need to know that this is the reason why I am having. Uh, uh, these are the precursors, or you could say these are the indicators telling you about some heart problem. So go get a heart checkup done and be confident enough. I never suffered from breathlessness, chest heaviness, palpitations, chest pain while doing any normal activity, day to day activity. I can climb inclined surface, that is railway bridge, or two floors without getting any problem like breathlessness, chest heaviness, palpitation, chest pain. I can walk 2 kilometers on plain ground without getting breathlessness, of course, the same thing again. And my daily activities are not at all restricted by symptoms like breathlessness, chest heaviness, palpitation, or chest pain. So, thank you for patient listening. If there are any questions, I am here to answer you.
If anyone want to ask questions, please give it in a chat box. Thank you, Dr. Priyanka, for giving such a nice knowledge regarding heart care, and you told every test and every investigation, because many people don't know how to investigate the
Very
path of
true.
diagnosis.
Very true.
So I think if anyone want to ask questions, they can message me after that also. Thank you, and we are ending the session. Thank you for the patience listening to all the listeners also. And we'll meet tomorrow at the same time at 5 p.m. in the evening with new Durga, Dr. Sudekha Segre, new topic, polycystic ovarian disease, PCOS. So thank you. Ending with,
Thank you, Dr. Shita.
yeah, okay, bye.